Thousands of Mainers suffer from some form of clinical depression, but how that illness is defined is changing. Mental health professionals are now putting less emphasis on how long a person has been experiencing symptoms and more on how intense those symptoms are. And as News Center Maine's Chris Costa shows us in this month's Let's Talk About It segment, clinicians still say the holidays can amplify those feelings of anxiety or depression.
First is the new clinical definition of major depressive disorder. This is the DSM-5-TR. This is the book that defines diagnoses for mental health issues. The new criteria for someone to be diagnosed with depression decreases the amount of time a person must experience symptoms, down from 6 months to just 2 weeks. That's a big deal, according to Amy Barrier, a licensed clinical social worker with Penobscot Community Health Center.
It's now looked at under intensity rather than time period. It's not these arbitrary time frames. It's more who is the person and how are they existing in their body. And that's what's important.
And major depressive disorder is different than seasonal affective disorder, which does not have a diagnosis in the DSM. People experiencing seasonal affective disorder may feel low, but they can still function.
And people with major depression may be able to get up and force themselves to do those things, but it's hard.
Second, the holidays can amplify any current mental health struggles. Barrier says family interactions and financial stress are two main reasons. She says it's critical to prioritize your needs, including spending time with people rather than money on gifts.
All of these things that we celebrate are human-made. And so we ultimately can shift time a little bit, and it's okay. And if people want to spend time with us, then they'll make allowances for us. And friends are important too.
So here are some symptoms to look for when it comes to major depressive disorder. Trouble focusing, trouble getting out of bed, trouble doing activities of daily living, such as personal hygiene. And when it comes to getting help, everyone has different needs, but there are some common themes.
Check in on them and be there for them. Because a lot of times that's what's missing, is just knowing that somebody is there and caring for them.
That was Chris Costa reporting. And if you or a loved one is struggling, there are resources to help. NAMI Maine has a teen text number. That is 62640. There's also a statewide crisis hotline. It's 1-888-568-1112. Those phone lines offer 24/7 access to trained specialists. And right now, if you head to our News Center Maine Plus app on Roku, Apple TV, or Amazon Fire, you will find a special Let's Talk About It program. We cover a variety of mental health topics from kids and teens to parenting and much more.